who is the president of the National Association for the Advancement of Orthotics and Prosthetics. Mr. Guth is also the owner of RGP Prosthetic Research Center, the largest prosthetic manufacturer on the West Coast. Founded in 1987, the National Association for the Advancement of Orthotics and Prosthetics is a nonprofit trade association dedicated to educating the public and promoting public policy in the interest of O&P patients. Welcome.
Thank you. Thank you, Chairman Bradley, Ranking Member Davis, and members of the subcommittee. Thank you for this opportunity to testify on the role of small prosthetic businesses and their important work with veteran amputees who rely on quality prosthetic care or artificial limbs to return to full function. I am Tom Guth, and I am a certified prosthetist for RGP Prosthetic Research Center. I am here as a small business owner. RGP Prosthetic Research Center in San Diego was started by my father in 1947, and today RGP is one of the premier prosthetic clinics in the country. I've dedicated my career to developing new ways to increase the quality of life and comfort of amputees who use artificial limbs, many of whom are injured and amputee veterans who wish to continue an active lifestyle. I am here today representing the National Association for the Advancement of Orthotics and Prosthetics. NAAOP is a nonprofit trade association dedicated to educating the public and promoting public policy that is in the interest of orthotics and prosthetic patient and providers who serve them. I am testifying today to bring forth the view of small business professionals serving O&P patients, particularly those who work with our nation's veterans through the VA. RGP has served veteran amputees as a component of our prosthetic practice for over 6 decades, and we are proud of our service to the VA. However, the current system is not always without challenges to both the veteran in gaining access to appropriate prosthetic care and the private practitioner in serving that patient. Take, for example, my patient of nearly 40 years, who I will refer to as Tom to protect his confidentiality. I first designed and fabricated a prosthetic limb for Tom after his return from Vietnam, where a landmine had taken off one of his legs above the knee. For nearly 40 years, I have worked with the local VA prosthetic chief and Tom to provide high-quality prosthetic care. Recently, after 8 years of walking on the same prosthetic limb, Tom came to my office with a VA prescription for a new prosthesis with the same design as his existing limb. But technology had changed dramatically over the past 8 years, and I recommended that Tom receive a microprocessed prosthetic knee unit that would allow him to walk more consistently and safely. Tom wanted to try the new knee, but the local VA staff denied Tom access to the microprocess unit, stating that he did not need the more recent technology and generally giving him the runaround. Tom then became ill and is fighting to return to his health. His request for the microprocess knee has not been approved to this day, although he could have benefited from it for months now. So it is important to realize that the positive pronouncements and favorable signals from the National VA office that the program covers whatever the amputee veteran needs are sometimes lost in translation at the regional and local levels. As service members return from Iraq and Afghanistan with amputations and neuromuscular skeletal injuries, many will need prosthesis and orthosis. The VA contracts with the utilized private business to provide prosthetic care to approximately 97% of the O&P patients. However, as it stands, anecdotal evidence suggests that there are significant inconsistencies in access to quality O&P care throughout the country. It also appears that in some areas of the country, such as San Diego, the VA is actively working to increase the amount of O&P care provided in-house by VA-hired O&P staff and decrease veterans' access to the private O&P practices and professionals who have served the VA patients well for decades. Overall, with the collaboration of small business, the VA has provided quality orthotic and prosthetic care to the veterans over the years, whether or not their underlying impairment was service-connected. But there are many areas where inconsistencies across the country are apparent and require improvement. The adoption of the VA several years ago of a regional decision-making through the VISN's Regional Service Network has highlighted these inconsistencies. It is imperative that the VA establish standards that all veterans understand and can rely on with regards to their prosthetic and orthotic needs. This is why NAAOP supports H.R. 5730, the Injured and Amputee Bill of Rights. H.R. 5730 proposes the establishment of a Bill of Rights for the recipients of VA health care who require orthotic and prosthetic services. This Bill of Rights will help ensure that all veterans across the country have consistent access to the highest quality of care, timely service, and the most effective and technology-advanced treatment available. NAAOP believes that the adoption of the Bill of Rights will establish a consistent set of standards that will form the basis of expectations of all veterans who require orthotic and prosthetic care. The bill proposes that every VA facility throughout the country be required to promptly display the Bill of Rights. In this manner, the veteran across the country will be able to read and understand what they can expect from the VA healthcare system. And if a veteran is not having their orthotic and prosthetic needs met, they will be able to avail themselves of their rights. To improve the current bill, we propose that a copy of the Bill of Rights be required to be provided in paper form to every veteran attending the amputee or rehabilitation clinic, and that each patient sign off on the clinical file to indicate that they have received and read the document. In addition, we propose that Congress direct the VA to establish a toll-free, dedicated telephone number to report instances of non-compliance with these rights, as an omnibus man could help resolve disagreements. NAAOP thanks this committee for examining how small prosthetic businesses work with the Department of Veterans Affairs to provide for the needs of veterans with injuries and disabilities requiring orthotic and prosthetic care. I thank you for this opportunity to testify before the committee.